Government has this week approved a plan to allow for the creation of new regional health areas to integrate both hospital and community healthcare, and it's part of the key Sláintecare reforms. To explain it further, I'm joined by West Cork Social Democrat Deputy Holly Kearns. Good morning to you, Holly.
Good morning, Patricia.
And you're welcome to the programme. Now, is this, firstly, when I started hearing and reading up about this particular new regional health areas, is this plan in any way like the old health board structure?
No, I suppose it has some similarities in how it's divvied out into 6 different regions, but it's very different in terms of how it's set up. You know, we had to disband those former regional health services because they were so kind of dogged by vested interests and political persuasion and stuff. However, the new proposed setup of regions would be to kind of tackle that and to ensure there's equal access to services. And it's a very key component of Sláintecare, Patricia. And the whole idea is that basically regionalisation would ensure that there's a fair sharing out of resources, that services would be provided in each region. So you won't have this kind of postcode lottery for access to services where good services are available in some parts of the country and yet they're not at all available in other parts of the country. So it's about ensuring equal access to public healthcare, and there would be one head of services and that person would have actual legal accountability for ensuring that there's adequate services provided. To date, there has never been any accountability in our health services. So it would mean that there's actually a budget going to each of the 6 regions. Then that budget would be based on the population of the region, the socio-economic profile of the region, the age demographic, all of those things. But for everybody listening, Patricia, I'm not sure if everyone will necessarily know what Sláintecare is. And this, proposal to this introduction of the regionalisation is a key component of Sláintecare. But Sláintecare is basically, it's an overall national health policy. It's costed and tested. It's a cross-party policy for a national health service. And like I said, regionalisation is a key component to it. So
because it's fair to say that the highly centralised approach to healthcare simply wasn't working.
Exactly. So Sláintecare is not revolutionary, but I think it really feels that way to us in Ireland because we're all so used to paying €60 to see a GP. It's impossible to imagine how the state could afford to pay for things like that. For all of those things. But Patricia, it's not revolutionary. It would simply deliver what all other EU countries have, what most other EU citizens have, a public health service where you get health based on need and not the ability to pay. We're the only country in Europe that doesn't have universal access to healthcare that is free at the point of need. And currently, we have 1 million people on hospital waiting lists. I can't emphasise enough the impact of not having a national health service. And to give your listeners an example, I'm going to focus on disability services because the geographical lottery in relation to this is shocking, especially since the government is saying that progressing disability service was supposed to remove these geographical lotteries. It's actually reinforced them. So in CHO4, the Cork Kerry region, Down Syndrome Ireland survey confirmed that 64% of respondents in the Cork Kerry region said their children received no therapy of any kind in the last year. And that figure was 35% in Galway, Mayo. And the HSE in response to one of...
desperately frustrating for families, isn't it?
It is desperate. And the HSE in response to a parliamentary question to me revealed that the Kinsale Bandon Carrigaline team, the Community Disability Network team there, or the Children's Disability Network team, is missing a physio, 2 occupational therapists, 0.5 of a speech and language therapist, and 2 psychologists. At a committee meeting in recent weeks, in response to one of my questions, the HSE confirmed to me that not one of the 91 Children's Disability Network teams are fully staffed. And I think, sometimes we have to stop and ask ourselves, why? Why do we have this dysfunctional health service? Why don't we implement Sláintecare? And, the reality is because since the establishment of our health service, it has been dogged by vested interests. And some people really benefit from that current model. Private healthcare providers basically benefit from that model because the people who can afford to go private will.
And we've always been told that it isn't about funding. And we seem to, every time that there's a crisis in healthcare, the government will just pour more money into the health service. So the money seems to be there, but it's actually how we allocate it and how we spend it. So from what I can gather from what you're saying, these new regional health authorities will be able to plan, will be able to fund, and then will be able to manage the delivery right in their own areas.
Yeah, exactly. So like I said, central component of Sláintecare, and that was agreed in 2017, and then a map of the areas was agreed in 2019 by the former government. So it means dividing the areas into 6 geographical areas and integrating hospital and community services. And we need this because the HSE has become too large, too bureaucratic and too centralised. So it would mean regional areas would have more autonomy and budgets would be assigned to those areas based on need, having regard to all of those different things I mentioned before: age profile, geographical spread. And it's also important because it would lead to clinical and legal accountability for health outcomes in those areas, as well as spendings and budget. And it would mean that when something goes wrong, like for example what happened in South Kerry CAMS recently, that the buck would stop with somebody.
Yeah, but you mean somebody could lose their job?
Absolutely. There'd be actual accountability for the first time. And like you talk about the money that goes into it, at the moment we're spending 22 billion on health services. But this money does go into a black hole. It's not just our opinion. It's not just my opinion I'm saying that. Leaked recordings of meetings with senior Department of Health officials revealed that those officials also believe there's a financial black hole, as well as recruitment targets that are what they called fake because everybody knows they won't be reached. And there's also no way for the Department of Health to follow the money at the moment it provides to the HSE because there is no integrated financial management system, all of those different things. But so what happened this week? I think it was no surprise. So Donnelly brought proposals for the implementation of the RHAs to Cabinet on Tuesday, and he suggested 3 options. 1, doing nothing. 2, doing the bare minimum. Or 3, making the radical changes that Sláintecare envisioned. And the Cabinet has chosen option 2, doing the bare minimum. So they'll roll them out to a certain extent, but this will not provide the reform that we need. That minimalist approach would still see power centralised in HSE instead of regional areas being given autonomy, instead of being established with a strong legal footing, with specific legislation, they'll be administrative only. So essentially, they'll be like satellite offices of the HSE instead of being independent. So that means that the centralised HSE managers will remain in control instead of decision-making and accountability happening locally, which we know has better outcomes. So it will inevitably lead to increased cost, further bureaucracy, all of those things. And the Minister said that the regional health areas will get their own budget. That seems to be the only concession, but it seems like they'll have little autonomy about how it's actually spent. So that's incredibly disappointing. Sláintecare was supposed to be a radical restructure of the health service, something that is so badly needed. And the manner in which the government is now proposing to implement those regional health areas is actually a betrayal of the vision of that policy, and it means we won't get the kind of services.
So you're now saying that these regional health authorities are not going to work?
No, not if it's actually carried out properly.
Okay.
And I suppose, Patricia, it's not really surprising that there's kind of a half-hearted attempt at Sláintecare happening now because, you know, recently we saw key figures in the Sláintecare advisory body. And one of the key recommendations of Sláintecare, there'd be an independent advisory body because, you know, one of the things that came out of the Sláintecare committee, and that committee was chaired by my co-leader of the Social Democrats, Roisin Shortall, is that we can't task the implementation of this new policy. You know, the Department of Health can't do that and the HSE can't do that because they're the very institutions
that we want
that have
change.
An aversion to change.
Yeah. So we saw a number of them resign.
Exactly. So what happened was, you know, as this, you know, we had the new government forming, no action been taken, and key figures in that independent implementation advisory body resigning, citing a lack of political will. And then what happened? The government decided that instead of that body carrying out the first, one of the most important parts of Sláintecare, which is regionalisation, they decided that senior figures in the HSE and the Department of Health would be tasked with implementing regionalisation. The very bodies, the very organisations who have that institutional aversion to it have been tasked with implementing it, and lo and behold, they're doing the bare minimum. So it won't actually amount to a national health service. It will be a kind of a failed attempt at that, where we still see the interests of big private companies prioritised over the interests of, all of the people in the country who just want to have access to healthcare at the point of need. They want to ensure that we don't have. There's almost 1 million people on waiting lists at the moment.
Yeah, and we have to do. Yeah. Okay, just some questions in. Councillor Declan Hurley, friends of the Bantry General Hospital, says, could you ask Holly how she sees Bantry General Hospital under the new structure? Is it going to be good for the hospital's future?
I would say absolutely. The whole purpose of Sláintecare is to provide healthcare at the point of need. So we spoke about that you'd have a budget for a region. And for example, if there were 6 regions, the area that Cork would be in, that budget would be spent based on the age profile of the area, the geographical spread of the area, all of those things. So of course, if we had our own budget, we wouldn't be saying, oh, we don't need these services here. We know we have a huge geographical area. We know we have huge issues getting emergency services, getting, acute care, all of these things. So finally, we would have, a rollout of budgets where you had to provide, certain services, necessary services, essential services in an area. And if they weren't being provided, well, then essentially that person would lose their job and somebody else would roll in.
Okay, but somebody else is worried about, with all these new regional health areas, will we see a lot of new managers and new teams? People always worry about the pen pushers and the amount of managers that we have within our health service.
I think that's the problem that we have at the moment. So we have this centralised model, and as we know, like a model for Dublin doesn't work in West Cork when we talk about the socioeconomics, the age profile, the geographical spread, all of those things. So there's a lot of bureaucracy now. They're setting up children's disability network teams that don't work in this area. I cited the Carrigaline, Kinsale region and the lack of staff. What we need is more local autonomy over our budgets, over what we need, because we know what we need, in a certain region, and we need that focus to move away from all of the bureaucracy. And I completely understand what that listener is asking. At the Children's Disability Network teams that I spoke about earlier, it just seems they've been a complete failure. What was the point in introducing these? They were supposed to remove that geographical lottery, remove the long waiting list, and all they've done is amplify them. And I think that is because we still have this centralised model. And what we need is, regional policies and somebody who's held accountable for ensuring that those services are provided in a region. And like I said, this isn't some kind of, I think it can feel like a far-flung dream in Ireland. Like, how could we have a health service like that? It seems so out of reach for us. Every other country has it. Of course we can have it. It's costed, it's tested. The only component that is missing is the political will to implement it. Okay,
a lot of people have views on this. Caroline in Mallow says, I welcome the idea of these regional health areas. Decisions could be made locally, and that will be so important, because when you make a decision locally, you know the value of a service, for example, like Mallow Hospital or Bantry Hospital. But over the years, we've seen some facilities close. Heatherside Hospital in Mallow, money wasted closing down these services, and then a building going to waste. If local management were here making those decisions, they would know the value of those services. While Mervyn in Bandon says, why will this new system be any different than the last was set up by the HSE, was set up to replace the health boards, and we were told that was going to be the be all and end all. How will this new system work regionally? Is it just the same thing but under a different name? People, I suppose, are sceptical, Holly, because we've seen change, and we've heard talk about change in the past, and no matter what we seem to do with our health service, we never seem to be able to get it right.
Yeah, completely understand where your listeners are coming from, and I share their concerns, because our health service at the moment is entirely dysfunctional. It's almost 1 million people on waiting lists, another 250,000 people on basic waiting lists for basic community services like speech and language therapy, all of those things. But I think the thing that we need to realise is that we spend more than most other countries on our health services. And this is what we're left with. And that is because of the approach we're taking. And like I said, is completely unique in a European context. The health boards that we had before, the reason we had to do away with them is because of the political influence there was on them. And, even today we see that, the amount of money going into an area is more based on whether or not that area has a minister than whether the area needs that money.
That absolutely is what it shouldn't be. Okay.